Senior Moments, sponsored by the Empowering Seniors Group on News Talk KVNU, 102 FM and 610 AM.
Good morning. This is the Senior Moments Show. I am your host today, Sid Roeder. Visiting today was Julie Baumgartner. She is a registered nurse and also an IV specialist for Modwella. Am I saying that right?
Modwella, yes.
Modwella. Okay. And let me talk about our sponsor really quick, and then we're going to dive into what you do, Julie. So our sponsor is the Empowering Seniors Group, which is a group of professionals that has dedicated their time and effort to provide information to seniors, their family members, and really anybody who cares. If you'd like to learn more about the Empowering Seniors Group, you can do so online at empoweringseniors.info, or you can email us at empoweringseniorscv@gmail.com, and the CV stands for Cache Valley. And lastly, if you have any suggestions for our show, you can call me personally at 435-512-6406. So, Julie, I've known you for a while, so I'm going to introduce you as my past client, friend, and now my personal IV nurse that comes to my house.
All of the above.
All of the above. So let's maybe have, for our listeners' sake, let's tell us a little bit about you and how you got to what you're doing now.
Yeah, I have been a nurse for almost 21 years now, which seems like a really long time. When I say that, it makes me feel old. But I have loved being a nurse. The majority of my nursing career has been in the critical care field. So I have worked in ICUs and ERs, and I still work in the hospital in the cardiac cath lab. So I take care of patients who are having heart attacks and need stents or pacemakers or other cardiac needs. This portion of my nursing career kind of fell in my lap a few months ago. I feel like it was meant to be, and I have loved this aspect of nursing where it is more of the preventative type of care, and also reactionary, where I can take care of people who are actively sick. But through Modwella, I've been able to just see a whole different type of client and patient, and I've loved this aspect of nursing. It's been a great way to branch out and to continue learning, which I always love to do.
Okay, well, let's talk a little bit about, so you come into people's homes with an IV infusion.
Yes.
And then there is certain things you can add to that. You can also give some shots. So maybe you want to talk a little bit about the products and the benefits of the different things.
Yes, so Modwella is based off of the idea of Modwella is concierge IV services in the home. So I come to you, to your home. We don't have a location, which is the best, because when you're feeling sick, you don't really want to go somewhere to be taken care of. So you are taken care of in your home, and I can come in and give you IV infusions that include vitamins and minerals and a bunch of different things to help boost your health and to help you get over your sicknesses faster. Our most common IV infusion is called the Revive. That's the one that we recommend for almost everybody, because most people can use a good boost of vitamins. So if you're sick with a virus or even a bacterial infection, we'll recommend the Revive. Sometimes we'll add in things like Decadron, which is a steroid, that's the great thing about this company, is that I can not only give vitamin infusions, but I can come with medications as well. So a lot of the things that we give, so for like a migraine, I give you the exact same thing that you would get in the ER with those medications. I can give stuff for nausea and vomiting, nausea medications, and of course the IV fluids are always very helpful.
Right. So maybe I can just chime in with some my own experience. I've had one experience doing this, which is why I invited you to the radio show, because I figured this might be beneficial for more people than just me. And I contacted you because I had an extremely busy week with some training going on and the Home and Garden Show, and I was sick right before. And so you did recommend the Revive.
The Revive IV infusion. Yes.
And I do have to say, it was absolutely amazing. So, but for our listeners, what's the typical process? If someone calls you, how does the process work?
So when somebody calls me, I usually ask what their needs are, to see what their purpose is, what they're hoping to gain from receiving an IV infusion. And then we talk about their needs, and I can tailor whatever I give. Nothing is pre-mixed, so when I come in the home, I give things one at a time. So although we do have cocktails of things we give all at once, or more typically together, I can also add or subtract things based on your individual needs. So we'll talk about that when you call. We'll make the appointment, and then when I come, I'll come into the home. We'll find a comfortable spot for you to sit or lay down in your bed, or on your couch, wherever you feel best. And we'll get that IV started, take some vital signs, and then go ahead and start the actual infusion. So our company is overseen by a physician and a nurse practitioner. So everything, and that's how I have the ability to give medications in the home. So everything that I do is overseen by them. And so once I take your vital signs, I will send that information and your health history over to our provider, with what I recommend for your particular circumstance. We can even call the provider if there's questions that I can't answer in the home. So we always have that doctor or nurse practitioner available to call and consult with at any time. But they always oversee everything we do. And then we start adding in the supplements based on your needs.
That's fabulous. And I remember when we first spoke, you did. There's also a portal that people sign on, and that portal also asks some health questions, correct?
Right. So we have you fill out that health history. It's relatively short and simple. It's not too complex. And then a consent form, of course, for us to come in and give you the IV. So there's two forms we have you fill out ahead of time. If you're not comfortable with getting on your phone and clicking into a thing, I can walk you through that. We can do that in the home. I do like to try to get the health history beforehand, but we can even just talk about that. So if that's a concern, we can definitely help walk you through that, filling out that health history and consent form.
Do you find that there are reactions that happen that are negative when you do this ever, or does the health history beforehand?
The health history beforehand really does help with that, to know of any kind of allergic reactions or things that we might encounter. We'll definitely talk about any of that. There might be some side effects that people will experience, but that doesn't necessarily mean that they're a negative effect.
Yeah. And as you've told me, there's always some variation.
There's some variation. Everybody experiences it differently.
Okay. We're already coming up on our first break here in a hurry. So, Julie, I want to give you a chance to mention your phone number, contact information, website, whatever you'd like to mention.
Yes. The best way to get a hold of me is directly through my phone number. It is 435-770-2454. We do have a website. You'd want to go to idaho.modwella.com, and Modwella is spelled Modwella.
Thank you, Julie. This is the Senior Moments Show. Again, we are sponsored by the Empowering Seniors Group. We're going to take a short break right now. Stay tuned. We'll be right back.
Reed's Pharmacy in Hiram offers free delivery service 5 days a week, Monday through Friday throughout the valley. Just stay home and they will deliver to you. With 25 different suppliers, they won't have the shortage that others might have. Also, with compounding and many other services, they will be able to serve all your needs. In order to stay safe and help slow the spread, please call Reed's Pharmacy in Hiram at 245-DRUG and they will take care of you.
It's tough knowing how to care for an aging parent. Mom has always been there for me, but now I need to be there for her. When we found out she needed surgery, I wondered how I could attend to her needs and still be mom to my kids. I was so relieved to learn about transitional rehab at Maple Springs in North Logan. From the nurses to the physical therapists, it was like their whole staff was focused on helping Mom get better. Maple Springs in North Logan was an answer to my prayers.
Learn more at maplespringsnorthlogan.com or call 753-9400.
Did you know 1 in 3 people will visit a nursing home? Did you know that once there, they will stay there for an average of 3 years? Did you also know there are insurance options that can help cover this experience? Hi, I'm Tracy Ferris with Blue Water Health Insurance. It's not cheap to stay in a full-fledged nursing home. Long-term care insurance can help you or a loved one get the care they need and deserve. If you wait until you need it, you may be too late. Give me a call at 435-890-8155.
This is Mark Thurston with White Pine Funeral Services. The best time to plan is when you have time to plan. Having a prearranged funeral gives peace of mind for everyone involved. White Pine will customize your final wishes to fit your needs, from a traditional burial to cremation to a custom headstone. White Pine also accepts prearranged plans from other mortuaries, and we will absorb any transfer or revocation fees. No penalty to you. Visit whitepinefunerals.com or come and see us for more information.
White Pine Funeral Services, here when you need us most.
Welcome back. This is the Senior Moments Show. I'm your host, Sid Roederer, visiting today with Julie Baumgartner. She is an RN and also an IV specialist for Modwella, and you are mobile.
Yes. People love that I can come to their home. That's kind of what sets us apart as far as our IV offerings, is that we come to you, which means in your home. It could mean your office. It could mean the gym. It can mean a variety of places, but I come to you wherever works best.
Yeah, I do hear that sometimes where you exercise, you have a line of patients that take your services.
Yes. I'm a fitness instructor also, so I do offer injections like vitamin B12 and vitamin D injections. We have sometimes after my fitness classes where I give those, and that works out really great for everybody.
Yeah, that sounds fantastic. Let's talk a little bit about the benefits of the different cocktails and solutions that you have.
Yeah, so there are a lot of reasons why people reach out to me for these IVs. One of the most common ones is if somebody is feeling sick, like you did, Sid. Your experience of viral infection. A lot of things I've been treating recently include strep throat, long viruses that are taking upwards of 3 or 4 weeks to get rid of, sinus infections, COVID, all kinds of those things I can come and treat. So when I come and give you an IV infusion, there are multiple benefits and ways that you will notice you start feeling better. Included in the Revive cocktail, which is our most common cocktail, you'll find vitamin C, a high dose of vitamin C, which can actually help to kill off that virus. Used in a preventative way, it strengthens your cell walls so that viruses can't get in and make you sick. So vitamin C is amazing. We have an antioxidant called glutathione. It helps rid your body of toxins, which you kind of build up when you're sick for a long period of time. We do the B vitamin complex, which is great for your nerves. All of these are great for your immune system, and B12, which is great for energy as well. And then we also include magnesium and zinc, both of which help with your immune system and a variety of other processes in your body. And then lots of times I'll recommend a vitamin D injection, which is great for inflammation and immunity as well. We also have a medication called Toradol, which is an anti-inflammatory medication similar to ibuprofen that we give in the Revive cocktail. And that really helps with things like sinus pressure, sore throats, muscle aches and pains. A lot of people really love the Toradol in there. Other reasons why people will call is they don't want to get sick before a trip. So I often give pre-trip immunity infusions just to help ward off as you're traveling and flying all those germs that are in the air. Other reasons why you might have me come into your home for an IV would be migraine. The things I can give in the migraine cocktail are exactly what you would get in the ER. Nausea, vomiting, pregnancy issues, lots of morning sickness can be resolved through these IVs. So tons of benefits you can gain. But the huge ones are immune boosting and energy boosting.
Yeah, and I can vouch for that because we had a little conversation after. I had so much energy that I had a little trouble sleeping the first night.
She had an interesting response. Most people don't have trouble. Actually, most people do feel more tired after the first infusion, just because you do get magnesium, which helps with sleep, and then you also are kind of detoxing and your body's getting rid of some things, so that kind of can actually make you feel a little bit more tired the first day or so. But Sid had a great burst of energy where she was able to accomplish a lot more things, so that was great too.
Yes, I can vouch for that. I was going into a 3-day training where information was fed via fire hose, and it definitely kept me alert there and let me absorb the information, so I was grateful.
Yes.
That's awesome. Let's see. We've talked. You also have some other services that you provide. Do you want to touch on those?
Yeah. So I can come into your home and draw labs. We have different lab panels that we will run, and you will have access to all of those results. I also have a medical weight loss program that we can get started for you. We also provide something called NAD, which is really cool. It's an enzyme that you produce naturally in your body, but as you get older, you produce much less of it, and then you start experiencing symptoms of aging. So slower metabolism, harder time sleeping, more brain fog. A lot of those things can be treated with this NAD infusion, which is more of a process. It's a multiple treatment process, but a lot of people have really been feeling benefits from NAD. It also treats neurodegenerative changes, which is oftentimes a concern as we get older, such as Alzheimer's and Parkinson's. It has been shown to reduce the some of the symptoms. Obviously it's not a cure, but it does help reduce some of those symptoms of those things. It can also help prevent some of those things as well.
Yeah, I think that's really interesting for some of our senior listeners here.
Yeah.
So is there any other product that you have that's a little bit more geared towards senior issues?
Most of the things that we give can be given across the board. And I think what I would say to being geared more towards seniors is that's where our customization comes in. We'll take a complete look at the health history and see exactly what your needs are. If you have some restrictions that prohibit you from certain add-ins, that will be completely tailored and customized to your needs. And so that's how we can gear it more towards senior needs.
Okay. And when you were talking about labs, do you ever do the labs also to make a better recommendation what product might be beneficial for your clients?
Yeah, we can definitely do that. The labs will tell us a lot of kind of where you sit as far as your health and wellness goes. So we could definitely do your labs to determine what would be best for you if you haven't had lab work done recently.
Okay. And maybe this would be a good time to maybe ask the question, what range in price? I mean, I think we all understood that the pricing changes depending on what vitamins or supplements you're asking for.
Yeah,
but
because it's highly...
Yeah. What's a typical range of pricing? It's
highly customizable. So it can range anywhere from $99 for a simple bag of saline with no add-ins up to $219 is our Revive cocktail. It's the biggest bang for your buck. First-time customers always get a 10% discount. It can still vary from there depending on if you need more or less, but that's kind of the range. $100 to $200 is about average. We do accept HSA cards, which people love, and all other forms of payment as well. Okay, that's great. We're already coming up on our second break here, so I want to give you another chance, Julie, to mention your contact information. Yeah, the best way to get a hold of me is directly by my phone. It is 435-770-2454. Okay, and do you want to mention the website really quickly? Yeah, the website is idaho.modwella.com. And maybe that ramps me up to mention to our clients, yes, you do cover Idaho, you do cover Franklin County and Cache County, yes. Any other surrounding counties? Yes, Franklin and Cache County primarily. I can travel further. There would be a travel fee associated if I go beyond that, but I can travel further. Okay, perfect. Well, we're coming up on our second break here. This is the Senior Moments Show. We are sponsored by the Empowering Seniors Group. Stay tuned. We'll be back with a little bit more.
This is Brian Erickson for the Sunshine Minute. Each day, our nurses, CNAs, cooks and servers, housekeepers, laundry staff, music, recreation therapy teams, office staff, receptionists, and many more arrive around the clock. These heroes show up ready and willing to serve and protect our residents and clients. We are so grateful to our dedicated team. On behalf of the Board of Sunshine Terrace Foundation and our community, thank you to all of our employees for keeping us safe. We bring more to life together.
You have a lot of options when it comes to buying or selling a home. Do you list it online, sell it yourself, or do you have a realtor help? It's a major financial and emotional decision. A realtor is the liaison between buyers and sellers and really helps you navigate complex contracts, deadlines, and disclosures.
Hi, this is Sid Roeder with Achievement Realty. I work for you to get the best outcome for your situation. Let me earn your trust with a free consultation and a free market analysis. Call me today at 512-6406. Then list it, sell it, and move on.
Hi, this is Bruce with Comfort Care. One of the ways we help loved ones stay in their home is by assisting with daily tasks. These may include bathing, meal preparation, medication reminders, and housekeeping. We even help with shopping, transportation, and errands. Most of all, we offer a trusted level of care. Let us help you live your best life possible with Comfort Care. This is Bruce, and you can call me at 754-7676. Comfort Care, 754-7676.
Welcome back. This is the Senior Moments Show. I'm your host, Sid Roeder, visiting today with Julie Baumgartner. She is an RN and also an IV specialist for Modwella. Here in this area. She covers Utah and Idaho, Cache County, Franklin County, and a little bit more if you're willing to pay a travel fee. We've been talking about IV infusions and the benefits. Julie comes to your house. And one thing I haven't asked you yet, other than my own story of trying my first time, are there any fun stories that you can share with our listeners?
Yeah, I love hearing the results of my clients to hear. I always follow up with you within a day or two to see how you're doing after your IV infusion. So I love hearing how people are feeling better. So I've taken care of clients with food poisoning, for instance, who got the gut bug cocktail, which includes some Pepcid and some Zofran to help settle your stomach. And that one, those clients feel immediate relief. Like before I even leave, they're feeling much better because those medications work instantly. A lot of my clients who are struggling with a viral illness will feel immediate results or even the next day feel so much better as far as energy-wise, clearing of sinuses, those kinds of things. And then they do notice that their sicknesses will last less. The duration is much shorter, is a lot of times what I'll hear back from them is I was still sick, but it wasn't as long as usual, or the symptoms were much less than usual. So that's always really nice to hear that people are feeling such great results.
Yeah, and I can even vouch for that, because one of the reasons that I did call you was not only the training I anticipated, but it was that I had just been through a flu virus, and that had me down for 2 weeks with coughing still going on. And the result was amazing. So what if you had to pinpoint one story that stood out to you with any client, is there a story you can share with us?
I have a story with NAD specifically. I had a client with NAD who was using it for chronic pain, and she was specifically having a back flare-up, pain in her back, which she experiences frequently. Obviously, with chronic pain, it's there a lot. NAD helps heal cells, so it helps those areas that are causing pain. And she's gone through the complete course of NAD and is no longer experiencing back pain, which is life-changing for her, because as we know, back pain can be debilitating. NAD stories are really cool because people come looking for a variety of different things, help with the NAD. So their experiences are always going to be different, but I always like that story of that improvement in her back pain, because it's life-changing.
Yeah, that's great. I do want to you mentioned before that some of your clients come in before they travel. I'm kind of curious to hear what you recommend before travel. Is that linked to what areas they're going to, or what do you
Not
recommend?
specific areas. Mostly it's linked to longer travel days or flight travel, because as we know, when we're on airplanes, that air is recirculating. You're in high concentration of people. So I typically recommend a pre-travel immunity infusion within 2 to 3 days of your travel plans, of when you're planning to depart, just to help give your body that extra boost to fight off infection as you're traveling. However, if you are experiencing an illness within a week or so of traveling, I would recommend to do it as you're experiencing that illness to help get over that, and then possibly even again right before you go, just to help boost you for your travel.
Yeah, that's great. We're almost at the end of our show here today. So is there anything that you can think of that I haven't asked you about that you'd like to share with our listeners?
I don't think we talked about how long an appointment takes. So the total time that I'm there in your house is usually an hour, sometimes less. So it really is pretty a quick appointment, relatively speaking, as far as by the time I come in, start your IV, take your vital signs, and infuse an entire liter of fluid, adding in the add-ins as we go. We finish by taking your vital signs, removing your IV, and possibly setting up another appointment for the next time. So total appointment time is about an hour. It goes by really quickly. We get a chance to chat, talk about a variety of different things. I've loved going into the home and getting to know my clients, who oftentimes, most of the time, then become friends. So it's amazing.
That actually brings me up maybe to the last question, because we're almost there. So if someone prefers to have it done at their office, I'm assuming I can work alongside you?
Yes, you can work, and I don't even have to talk to you. We I love getting to know my clients, but I can just do it silently from the side as you continue to work from your computer or from your phone, or whatever it is you need to do. That's definitely an option for me to come in, and you just continue on with your day. I had a client, she was from home, but she was coordinating some construction things that she had, and she was on her phone the whole time, and I just did my thing from the side, didn't interrupt her, and it was great.
Perfect. We're at the end of our show, so I want to give you one last chance to mention your phone number.
Perfect. Yes, my phone number is 435-770-2454. Feel free to text or call me on that number, and you can find more information on our website at idaho.modwella.com. And don't be confused by the Idaho. That's just if you happen to reach out on the Idaho website, that is another way you can get a hold of me.
Thank you, Julie. This is the Senior Moment Show. We hope you tune in again next week.